My name is Phil Perazio, and I'm a urologic oncologist, a surgeon. Like many of you, I absolutely love what I do, and I would not choose another profession. But I have struggled with professional identity, practice efficiency, and wellness over the years. Operate with Zen is a podcast designed to explore a mindful approach to surgery and to being a surgeon. By discussing these struggles and mindful solutions, I hope together we can create a community of strong and healthy surgeons. Enjoy. Welcome to this episode of Operate with Zen. Today, I have the great pleasure of being joined by good friend and colleague, Dr. Betsy Koehne. Betsy, please introduce yourself to the audience.
Hi, everyone. Phil, thank you again for having me. My name is Betsy Koehne. I am currently a first-year oncology fellow at the University of Washington. I just graduated from my urology residency at Loyola in the Chicago area last summer. Originally, I'm from Kansas City, Missouri, and had spent almost my whole life in Missouri until I went to Chicago for residency. So I'm from Kansas City, went to Truman State University for undergrad, and then the University of Missouri for medical school. And that's where I met my husband. And he is an infectious diseases doctor practicing here in Seattle too. And we got two dogs in medical school who are run our lives. And yeah, now we're here. I'm in my research year, and things are going well. Thank you.
Very cool. I remember, I don't know if you remember our first interaction. This kind of dates things almost perfectly. Kind of as I was starting this kind of mindfulness journey, you were applying for fellowships in residency. And I remember that's where our conversation went during fellowship interviews and fellowship conversations. And I'll let you kind of talk more about it, but Betsy is a deeply mindful person who has a long experience with mindfulness and with yoga. And we try and meet and do some yoga classes and such when we get together at meetings. But tell us kind of your personal history and experience with mindfulness, wherever you want to start with it.
Thank you. I think, well, I do also want to acknowledge that I remember that conversation when we first met also over Zoom during interviews, and I just really enjoyed that and have since enjoyed listening to the podcast and all the amazing guests that you've had on the show. So I think I'm pretty lucky because I come from a family in which my parents have been practicing transcendental meditation. That's the form of meditation that my family does. And my parents have been meditating since the 70s. And so I just grew up in a house in which my parents meditated twice a day for 45 minutes each time, which sounds still pretty crazy to me, even though I've known this my whole life. But so they've been practicing meditation twice a day my whole life from before I can even remember. And then I have two older sisters who learned how to meditate when they were pretty young. And it was just always going to be a thing that whenever I was at an appropriate age, I could learn how to meditate too. So I learned transcendental meditation when I was 11. And other mindfulness things that have become a really important part of my life are yoga. And I started doing yoga near the end of high school and have kept that up through college, medical school, and now here. And then just the way that principles from both of those things permeate into how I do other things. Like I like jogging, but some of the way that I think about jogging is informed by principles of yoga and meditation.
Yeah, absolutely. And we're going to touch on all of those, but we go from the very active meditation to kind of or very active activities with passive meditation. And we'll talk about what kind of all of those things mean, but let's start with transcendental meditation. And Brad Erickson, who was on the podcast last season, was also did a fair amount of transcendental meditation. So if you don't mind, just give us some basics of what transcendental meditation involves and how it may be different from, kind of the more mindfulness meditation that people may be more attuned to.
Yeah, okay. I'll have to look up Bradley Erickson sometime and connect on that point. Yeah, so transcendental meditation is really, it's a natural and effortless technique. And that's one of the things that I like the most about it. And once you learn, and you do have to learn through the transcendental meditation community and have a teacher, but once you learn, you can practice TM, that's the abbreviation for it. But you can practice TM anywhere. You don't have to have like a phone or an app, or it's a really simple process. I think sometimes people say they're like, well, I can't meditate, or my mind's too busy to meditate. But really, I mean, anyone can, in general, anyone can meditate, and the TM organization and technique is really, it's really inclusive, and it's encouraging, and it's always just whenever kind of there will be opportunities to ask questions, or for people to say like, oh, maybe like I'm thinking too much during my meditation, they always say it's okay. And the basic principle during transcendental meditation is that you're given a mantra, and the mantra doesn't have a meaning, but it's just a sound that allows your mind to start drifting down to these quieter levels. And as your mind is becoming quieter, you're often thinking thoughts. And the TM teaching is that these thoughts are really just stress being released. And so even, for example, if you have a meditation in which you think a lot of thoughts, the TM teachers would say that that's okay. You're just releasing a lot of stress. And one thing that I recently heard Maharishi, who was the person in the 70s who's brought transcendental meditation kind of to the world, and he taught the Beatles, and so that's kind of one of the things that TM is in pop culture for. But one of the things I heard him say recently, just on like an old recorded lecture that he had given, was just that is such as how anyone who can run can also walk. If you can like think fast and do things fast, you can also do things slow. It's just about having just this kind of opportunity to do it.
I love that metaphor. That's what I'll definitely carry forward. If you can run, you can walk, and same with meditation and transcendental meditation. I would say my first exposure, the first time I heard of transcendental meditation, was actually Howard Stern. And it's funny how kind of celebrities kind of can tune you into these things. I said, well, if Howard's doing this, and anybody who listens to Howard knows he's a skeptic about most things. If Howard's doing this, then maybe there's something to it. And I don't do transcendental meditation. I've never been trained to do it, but I find the science behind it fascinating. And there is, for anybody who's interested, there's some great books out there, but the science behind it and the mantras has to do with kind of basically changing brain waves. Mm-hmm. And our brains fluctuate between certain waves, and we think about them with active thought, rest, and sleep are just the basic brain waves to think about, and how you can actually modulate your brain waves and the way your brain is functioning through mantras, through sounds. And it's really a fascinating scientific process. If you are skeptical, or if you're interested and you really want to read into this, there's some really fascinating stuff about TM and brain waves. And I would encourage you to kind of look into that.
Yeah, that's a great point. In the brainwave that's characteristic of TM, it's not like the sleeping brain waves or awake brain waves, and it is an interesting state in which you're both deeply relaxed but also alert. And the TM people, they say that it's more relaxing and restoring than really deep sleep. But yeah, it is just kind of a different sort of state that maybe might not experience otherwise. But yeah, and I had a TM teacher who once, who was kind of part of some of the earlier brainwave experiments, and she said so she had to go and meditate in front of these people, and they had all the electrodes on her head, and she said she just thought thoughts the entire time, and when she finished she was like, oh, that's not going to work, they're not good. But it was the same, it was the same brainwaves that they had been
Yeah.
characterizing.
Yeah, and the basics of it, I want to make sure I get this right, and I apologize if I get it wrong. But gamma waves are kind of our active state. Delta waves are our sleeping state, and in between there's beta, alpha, and theta, and they have different levels of kind of consciousness and relaxation associated with them. And long story short, you can modulate your brain waves by meditating, which I don't think is rocket science or earth shattering. And it's really kind of fascinating how you can do that. And one of the fascinating things I found is we also modulate our brainwaves with simple things we do during the day, sometimes like watching TV, but TV modulates us in the wrong direction for relaxation.
Mm-hmm.
And whereas meditation will kind of move you in the direction where you're kind of calmed and relaxed. And as you said, it's more of a stress release than some of the other endeavors we may proceed with. So yeah, getting into a little science of TM.
Along that line, one other thing that, well, I think about it too in the relationship of the parasympathetic and sympathetic nervous system and all the mindfulness things, and breathing techniques, especially when you're breathing techniques that favor exhaling, are ways to get your body into the parasympathetic state versus the sympathetic state, which is if you want to be in the sympathetic state, that would be a more like inhale side, or if you are inhaling a lot doing rigorous activity, that's a more
and since this is a surgery-based podcast, those things happen in the operating room.
Right.
They happen all the time, right? Blood loss, something untoward happens. The first thing you do is start breathing quicker, and we tend to be focused on the inhalation as our breathing rate and our heart rate accelerates. And you can imagine that elevates our sympathetic system. Mm-hmm. And in response, we work to slow things down. And I think it's one of the fascinating things that meditation, no matter what modality you use, is mental conditioning. It's mm-hmm. a way for your brain and your nervous system to practice calming down in stressful situations.
Yeah, absolutely.
And I don't know if you want to share or if you have any thoughts about kind of surgical experiences you've had and how meditation or your practices outside of the operating room have helped.
Yeah, I think about that a lot. I think they're really deeply related in how I think of surgery in general. Especially, I mean, surgery can be such a high stress situation, but we don't want to come into it with a brain that's really going like up here, going 100 miles an hour, and to really be able to perform things that are both like creative and comprehensive and precise. You have to have a quiet mind and not be in the stressed hyperactive state. And so I think about, I mean, little things I'll do before surgery, mostly just things like some breathing as I'm kind of getting into the OR, doing my sync scrub. But I like to use little breathing techniques to just kind of calm my mind, especially if it's like a big case or maybe something I haven't done before, overtraining, just going into bigger and bigger cases. And I am a bit of a person who gets nervous about things. I'm not naturally just like always calm all the time. And so I rely on these things a lot to try to help calm my mind. And then just in general, kind of outside of the acute situation of going in and out of the OR, just having these other things in the life like meditation. And then, well, I guess one other thing I was going to mention about the OR, but sometimes like if things are kind of stressful, if I'm really focused, have to like remind myself to breathe. And that is something that I just think about from yoga, really more so than TM. But I'll just have like a voice of one of my yoga teachers kind of pop into my head, and like, oh yeah, I need to breathe.
And I love that. I think the scrub sink, when I have big open cases, I like to take the time to scrub my hands rather than just putting on Avogard, because there is something very visceral about that. And it's a way to kind of ground yourself and get present in the moment. You can take the time and think about scrubbing each finger, cleaning your hands, and kind of getting yourself in the right mindset for what you're about to do, especially for big open cases for me. So I agree with you completely on that. Interestingly, I was given a lecture the other day on mindfulness, and one of the specific questions they said is, how do you get prepared for the operating room? And I had to think about it for a little bit. And I'm just like you. I mean, I think we're all by nature anxious. We want things to go well all of the time. And we recognize the crazy privilege we have of doing surgery on people. And I think everybody's a little different. And I'll start it off by saying that. But I would say one of the things I don't do is I try not to over prepare. I think over preparation makes me nervous. So I've seen a patient in clinic, I've talked them through surgery, and I actually try not to touch their stuff until really the day of surgery. And I know Mr. Smith, Mrs. Jones, they're on the OR book, and then I'm going to see them that morning. And the way I prep is I walk in and I try and keep the same routine every morning. Come to my office, I do the consent forms, and by doing the consent forms, I'm looking at imaging to confirm laterality and the things we're doing. It gives me a surgical plan for the day. Then I go and meet Mr. or Mrs. Jones, whoever it may be, and the conversation happens. We do consent, and then I go to the operating room to check on it. And the point I'm making through this long-winded routine is that the routine lowers a lot of the anxiety about the day. I haven't over-prepared. I haven't been ruminating on what's going to happen. At this point in my career, I've done hundreds and hundreds, if not thousands, of operations. And I don't need to physically or mentally prepare for the steps of the case, but the preparation needs to happen in that day to lower anxiety levels. And like you said, be able to give the focus that patient deserves and needs, and try to be as present as I can in the operating room. Understanding that different people in different phases of their career are going to process things differently. That's kind of how I'm processing things now. And I don't know how that, if that resonates at all with you, Betsy, or if there's something you think about.
Yeah, I mean, absolutely. I think about that a lot, and personally, as I went as going through surgical training, and especially once I started doing open surgeries, and I think about my in the earlier years doing pediatric surgery, and I'm someone who would like I don't know, over prepare, but I kind of would like hyper dissect cases to just the like tiniest micro steps, and just like reading notes as I'm going into the operating room. And in a way, as I got later in the years, I mean, I don't have it figured out, but I recognize that it's not always the best thing for me to go into the room as I've just been like reading through these, 1, 2, 3, 4, 5, 6, like right before it, because then that has my brain in this other like more hyperactive space that's not really productive, or for the actual purpose of the day, meaning to do the surgery. And so I don't know, I'm still in this process of figuring out how to balance like both this side where and also, I mean, because I'm still a trainee, so I have to learn how everyone does things specifically and make sure that I really do know how to do all of the steps of these big cases. But yeah, as I kind of progress through it, I mean, I don't know how it's going to end up being for me in 5 or 10 years, but I think about that a lot. It's just balancing both, being able to come in with a more relaxed state of mind versus, having everything kind of amped up, I guess.
Yeah. And it's tricky. And I think we all progress through it. And just like we're talking about our mindfulness practices, surgery is a practice and it will evolve. And I give you credit for being thoughtful about these things, because I think so many people just kind of go through day by day, kind of by the seat of their pants. And I think taking the lessons from mindfulness and from yoga and being intentional about what we're doing just kind of speeds up the learning curve and helps you understand how you're going to function better, which ultimately leads to better outcomes for your patients, which is what we want. So let's we'll move a little into yoga now. Different kind of mindful practice, and you and I are both yoga enthusiasts. We'll put it that way. So tell us about yoga. How's yoga fit into your life now? And I know you're in the lab, so you've got a lot more time to do these things, at least physical activities, than you may in the upcoming next year or years. But what's your current practice, and what are your plans for the future with yoga?
Yes, yeah. I mean, I love yoga, and I think I mean, mostly during the pandemic, started incorporating home yoga, doing various YouTube videos with going to in studio practices, or in studio classes, and I think both of those are important for my own practice because I like sometimes doing home yoga where I can just spend more time in a pose I mean, I like at the end to, if I have the luxury of time, I will do just a long shavasana and have a little scented eye pillow, and that is a really good day if I get to heat up the eye pillow and just have the shavasana at the end for like 10 minutes. And that's a really nice way to end the practice that you don't always get in class when it's kind of time to like get up and go on with the day. But I just love group practices, and I like having different teachers. I always learn things from different teachers who will have different sequences or point out different things about the approach to the practice. And I like being with the group of people, and the way that going to a yoga class will really take me out of my mind for the day, and I don't have my eye on the clock, or I don't know exactly what time it is. And I think that's a really nice experience. And I like all sorts of yoga types. I primarily do vinyasa style, just a classic flow. A couple times I've done Kundalini yoga, which is a little bit more obscure. Have you done Kundalini?
I can't say that I have.
There was a couple of studios in Chicago that I went to. I mean, I truthfully have only done like a handful of the classes, but it's a really different style, and it has this the teachers told me that this is the oldest form of yoga, and so it involves doing these like repetitive kind of sequences for maybe a minute and a half, and then and it might be something that's pretty rigorous, or they do like if you've done breath of fire, that comes from Kundalini, and then at the end of this sequence, then you sit and meditate for a minute, and then you kind of go on the next one. But I don't know, I think that's interesting. But I like all sorts of yoga styles. And
Yeah, I agree with you. I tend to do mostly vinyasa flow, but especially when I travel and trying to meet up with some friends, a good hot yoga studio is great every now and then. I don't love Bikram, but I'll do it with good friends when they want to.
I have not done it, but there's a place here that that the urology department has actually had some monthly group yoga things that I haven't gone to yet. I haven't been able to, but I want to try it.
Yeah, I joke I sweat enough in a cold room. I don't need the heat to sweat, but there is a different experience to it. Yeah, and I think I also practice different types of meditation, and I think some of the purists will say you should pick one and stick with it. But I think just like there's different forms of exercise, there's different forms of meditation and yoga, and there's benefits to the different styles and learning something different. So I like practicing different methods and different styles. And I agree with you. Also, context can be more conducive to one than the other. I like slow flow, like you said, at home, where I can really hold poses and work on flexibility. Whereas when you're in a class, you're typically a little faster. You're working on, a little bit more sweat and kind of dynamic exercises, and reaping the benefit of kind of that community feel where everybody's working hard together. So
Mhm.
Yeah, I hear you. I enjoy doing different styles, and I think there's a lot of benefit to the different styles.
Yeah. And I guess I forgot to answer part of the question just about fitting it in my schedule, but I sort of categorize like when breaking down my schedule, I would say I overall put it in the exercise category in terms of if I'm going to go for a jog or do yoga. But I mean, there's overlap with in terms of the purpose of all of them, and a little bit. I'm a little bit seasonal in that in the winter I do much more yoga versus in the summer I'm trying to take advantage of going outside, so I do a little, not quite as much yoga.
Yeah, and it's probably really good for your body too to give it a break from the pounding of the running and kind of give it a little recovery as well too. Um, Yeah, I was going to share the last time we did a yoga class together, and one of the things that always surprises me is there's always something enlightening that you don't expect in a yoga class. And we were in San Diego. I think I'm sure you remember this.
Oh yeah.
This was after the SUO meeting, the Society of Urologic Oncology, where there was just this huge session on complications, and people got up to microphones and really opened their hearts and spoke deeply, which was not common for an
Mhm.
SUO meeting. And the very next day, 6 o'clock in the morning, we went to a yoga class, and the instructor opened up about how she had had a rough year and an even rougher week, and that our focus was going to be on beautiful pain, and how by
Mhm.
struggling together in class that we could all get better together. And then we went through the class and we were all talking at the end of it. And long story short, we were waiting for our Uber and said, we really appreciated your comments at the beginning, and it was appropriate to our meeting that just happened as surgeons. And she says, "Oh, wow, you guys are surgeons?" She says, "My brother's a surgeon." We said, "Oh yeah, what kind?" He said, "A urologist." And it turns out he's part of our urology community. I mean, the world is just so small and enlightening. It's pretty
Mhm.
incredible. So
It really, yeah, it really is. Yeah, that was a really both very fun experience and just a great way to kind of get away from the normal schedule of the meeting. And I really enjoyed it and appreciated that.
yeah, I'm hoping these are starting to be more routine as we get together at meetings, not just you and I, but others. And then it's starting to seem like the meetings are starting to incorporate wellness curriculum into them, which
Yeah,
seems great.
yeah, absolutely. I think that you've been a big part of that. I think that you've kind of been bringing it into the more popular urology culture, and I think that's great.
Well, I try, and I think it's important that at least, like I said, we're having the conversation. People are talking about these things, and it's one of the ways to get better. So, so you talked about meditation, we talked about yoga, and then we talked about running. And I jumbled my words before, but meditation and all that is technically passive mindfulness activities. And you can actively meditate or be mindful during activities. And it can be things like running. People also talk about super high stress activities like mountain climbing or ice climbing, where you have to be very rock climbing, where you're intently focused on what you're going to do, or you're going to fall, or you're going to get hurt, or things like that. But it doesn't have to be that crazy or that intense. Running is a great way to be mindful and meditate. So talk to us about kind of your active meditation practice and running.
Okay. Yeah, I've been jogging since kind of also late high school. I used to do dance my whole life and then went through this um, thing that I think a lot of people experience in which they can't really do that anymore. So yeah, I started running at the end of high school as I was transitioning to going to college and wasn't really going to be able to do dance for my primary exercise anymore. And I like jogging. I am an incredibly slow jogger. My husband and I, we go on runs together like every weekend day if the weather's nice. Otherwise, he also does yoga. And I have to say, he also learned transcendental meditation like a little over a year ago. But we do we run for 5 minutes and then we'll walk about 2 minutes. And I don't usually like time it, but just as kind of like a rule of thumb, I just incorporate a lot of walking. And I think it's just easier on joints, and I can just go a lot farther and longer. And yeah, I think running it's a great way to both be outside and just see the city or area you're in. I love going for jogs when I'm traveling as a way to see the neighborhoods. And I think, yeah, just a nice way to really just kind of get rid of some stress and have the clear the mind. And I think you said this on another one about bringing just about maybe something about how yoga kind of informed your running, and that you're thinking more about breathing,
Oh
because
yeah.
I think about that too from yoga.
Yoga improved a lot of my other workouts. It improved my breathing, and I struggled. I ran 2 marathons when I was a med student in New York. I used to run distance a lot, and I was a terrible breather, and I really struggled with it. And it wasn't until I started doing yoga regularly that my breathing got better. And yoga has also actually helped me with my strength training because it's made me so much more body aware, joint aware, muscle aware of what I'm actually doing. And you see much more benefit and much more reward if you can focus on the muscle group or whatever it is you're working on. So yeah, it's given me a ton of benefits outside of just those sessions.
Mm-hmm. Yeah, I've never done a full marathon, but I've done, I don't know, a lot of half marathons, not any recently. But I need to sign up for another one soon because these are just fun.
Yeah, halves are great distance.
Yeah.
10 miles, 13 miles, fun distances. You don't
Yeah.
have to train for months. You can really get out and enjoy it. And you get out there for long enough that you can get into, whether you want to call it a mindful state or a flow state, whatever it may be, you can
Mm-hmm.
unplug and just let your mind go. And it's a beautiful distance to
Yeah.
run.
Yeah. Yeah, absolutely.
I remember those being in retrospect now, being some of my first consciously kind of mindful experiences. We're training for marathons and just doing loops in Central Park. And then somewhere I'd be training with my buddy Paul, and both of us, somewhere around the 45-minute to hour mark, your mind just goes, and it's like quiet and peaceful. Doesn't matter what's going on around you. You're just able to check out. And I've been able to reduce that 45 minutes through things like mindfulness practices. And it helps me kind of get in that state a little bit easier, which it used to take much longer when I was running, but also something I learned from those kinds of exercises and activities.
And if I and I think about yoga as and this I've just heard from yoga teachers as getting is like a way to get the mind ready for meditation. And I think that kind of can apply to other things too if you just go to it with some intention. And
Yeah, I've heard yoga instructors say that too. And I don't know how true that is, but that basically yoga was created to facilitate meditation, both physical and mental. And the idea was it's not so comfortable to sit with your legs crossed, for an extended period of time. But by working on your flexibility and core strength and alignment and the things you do in a physical yoga class, it's easier to sit. And it also helps you prep for your breathing and mind control and such. So yeah.
and I think about as I go through a yoga class or start a jog or something, I kind of start with all the thoughts of the day running around, and then just over some time they just kind of, yeah, as you said, things go quiet, and eventually you just kind of like finally those things can sort of go step aside for a while. And I think that's how I think of yoga as getting the mind and body ready for meditation. It's just a little bit quieter and easier to go into that zone.
Yeah. And so here's the segue. Now I kind of see yoga as preparation for the operating room.
Mm.
And it's a way to understand kind of ergonomics and body positioning in the operating room, get my mind and breathing for that. So where I want to go with you next is you are right in this unique phase of your life where you are like half trainee, almost fully independent, and you've got this tremendous experience behind you and this tremendous future ahead of you. What are your plans for kind of and we talked a little bit about bringing mindfulness forward, but I'm really interested in how you're going to bring it forward to the trainees around you, how you plan on potentially talking about this or expanding this in your surgical career?
Yeah, that's a great question, and I don't have it all figured out, but it's something that I think will be really important. And um, it, I think I mean, certainly one thing I can do is just setting an example and being present. I think conversations around it help. I mean, I don't know if I'm going to specifically like take trainees to yoga or not, but I think one thing I already do with my peers or when I was in residency is just encouraging people to continue those habits like jogging or yoga, even if you feel like you're so busy you don't have time. That's really when it's most important to do those things, is when you feel like you don't have time. That's when, at least that's how I feel, is I think that's when you really need it the most. Um, and so I think just taking an interest in what people's personal kind of conglomeration and sort of like toolbox of techniques like this involves, and encouraging them to do that. But yeah, I mean, I certainly I want to be intentional about it, and I'm not quite sure yet though.
That's all right. Yeah, I think, this is the first step, is having the conversation that this is part of who we are as surgeons, and it's okay to talk about these things. It's okay to this is, normalizing these conversations and these thought processes going into the operating room. It's very normal, in fact, and whether you want to call it mindfulness or preparation, whatever it may be, that this is, I think, makes us better surgeons, and I think other people can benefit from it. I also encourage our trainees. We talk about workouts on a regular basis. What are you doing this week to take care of yourself? What are you eating? You cook anything good of late? And you're right. When you're under the most stress and it's the most challenging, and you want to just watch Netflix for 2 hours and eat McDonald's, that's the time to take 20 minutes and work out, and take another 20 minutes and cook yourself something healthy, or make the walk to the healthy supermarket or whatever it may be, because that's when your body actually needs it the most. And it'll allow you to get out of that rut, out of that area, and be somewhere more productive.
Yeah, yeah, absolutely. Yeah, and I think that's one of the kind of the main things I think about with my meditation practice, is that it's always, I'm supposed to meditate twice a day every day. I can't, I mean, that just it's a lot, and I don't quite do that. But it's something I always come back to, and I think when I like really feel a need, or almost like a craving, like I want to meditate, is when I'm really the most stressed, and that's when I will, and I'll really kind of get back into it if I've kind of fizzled out for a little bit.
Yeah, it is. And it's honest for both of us to say it. It is really hard to kind of keep up that routine. It takes time, and our lives are crazy busy. I do mine in the morning. Every morning I try and do 10 minutes. I try and also do it before I go to bed, which sometimes just ends up with me falling asleep, which is okay, which is not a terrible thing. And occasionally not occasionally, I look for times during the day when I can kind of sneak one in sometimes. Like, for instance, I got an MRI a couple of weeks ago. I was in great 20-minute meditation episode. I just got to sit in an MRI scanner with nobody bothering me, and had headphones on, and just kind of was able to take in that 20 minutes and get a little bit out of it. And so standing in line, waiting to pick up my kids, sometimes it's at the end of school day or something like that. There are these little moments throughout the day, and even 2 minutes of meditation is better than 0 minutes of meditation. So
yeah, absolutely. Yeah, I think like when I was in my chief year, one thing that I started doing that I just really enjoyed is I'd get up like a little bit early, and then go out to my couch and meditate, and then kind of like go back to sleep for a minute, and then it was almost like a little soft wake up in the morning, and then get up and do the day. And that was great. But yeah, and then but it's hard to get in the later one in the day. Well, we have two dogs, and the dogs go on 3 walks a day. They're very spoiled, and so I try to just kind of use that as the time when I'm taking them on their walk when I get home from work, or my husband and I walk them together every night before we go to bed, and just use that as a time to like be away from my phone and all the things going on, and just kind of enjoy the moment.
Yeah, that's incredible. That's another great time. Walks are another great time to just kind of be present, be mindful, especially pets. They remind us so much to be present, right?
Oh yeah.
When you come home, those dogs are all about you. When it's time to eat, they're all about their food. When it's time to walk, they're all about their walk.
Mhm.
There's a lot of really good lessons from our pets.
Oh yeah, I love pets. I mean, I'm a big dog person. I don't know what I'd do without them.
Yeah. Well, Betsy, we've been kind of all over the place. We've talked about meditation and yoga and running. We've talked about being a trainee, being faculty. I wanted to give you the opportunity to kind of take this conversation in any direction you want to go in, and anything else you may want to talk about.
Okay, thank you. So I wanted to just put this by you. One thing that one of the faculty here that we were talking about recently in terms of really just within the work context of sharing time between clinical and research stuff is he was saying that he was just saying that at this point we're just not people who every day are going to check off everything from our list, and we just have to kind of live with that. Um and so I've that really stuck with me, and I've been because I always, I think we all just want to be able to just check everything off, but I've been reflecting on that and just trying to think about ways that I can maybe just live a little bit more comfortably or with ease of with maybe when things are like when you just can't do everything. And I wonder if you have any thoughts about
Yeah,
that.
I definitely do. And that person is absolutely spot on. You're not going to get everything done every day. And it's part of kind of the mindful approach to being a surgeon, being a doctor, being a person is, don't pass judgment on it. You're not perfect. You don't have endless hours in the day, and there's only so much you can get done. So my practical strategies for doing that, number of things. I'll give you kind of two specific ones. One, before I go to bed at night, I try and do as much as I can to prep for the next day. So it's often, even if it's something simple like laying out a pair of scrubs, like just lay them out. It reduces the anxiety. So you don't have to think in the morning about that. It's done. It's there. All you have to do, wake up, put those things on. Little tasks like that can just lower anxieties. Before I go to bed, I journal. So the first part of that journal is just gratitude, 1 to 3 things. Keep it very brief. It can just be one thing, no more than 3. And then I have a to-do list, 1 to 3 things that must be done the next day. Right. And it may be pick up the kids from school. It may be a thrombus, whatever. There are 1 to 3 things that have to be done the next day. Everything else is a maybe.
Mm-hmm.
And it gives you a little bit of grace and understanding on how your day is going to progress. And the third part of the journal is just a reflection piece. And that just gives me time to kind of quiet down. But the other way that works out is we all have our checklists and we keep it in different forms. So this is a hold this up. Not that you can see any of the details on it, but there's check boxes and there's circles. The circles are the things that needed to be done today, and they are checked off. The day's ending here on the East Coast. There's a lot of empty boxes there that have not been done. And that's okay. They'll carry over into the next checklist. But I got the things done I needed to get done today. I checked off a lot of other things, but I didn't check off everything.
Mm-hmm.
And giving yourself the grace and understanding what needs to be done and what's optional, I think is a nice way of quantifying that moving forward. So maybe that'll work for you. Try that.
Oh, thank you. Yeah, I like the gratitude thing. I think that's a good technique. If I remember, then I would like to think of a few things that I'm thankful for the day. And then I like your philosophy about just being like not just being easy on ourselves and not being, I think in general we're often tend to be pretty hard on ourselves, and I think we can just always show ourselves some more grace. And
Yeah. And think about, one of the, being a cancer surgeon, you and I are both cancer surgeons. is we deal with patients who are in much more dire circumstances than we are,
Mhm.
right? And our days may be stressful and we may have some really challenging things going on, but we don't have a life-threatening tumor in us at this moment. And often thinking about what we're doing on a daily basis often helps me get context too for that checklist. And there's some things there like working on my kids not retirement, their 529s, which is their educational fund, right? I mean, yeah, that's important, but it's not cancer, right? And putting those things in context kind of help us understand where we kind of sit in this, in this world, and kind of, in the larger scheme of things. So that helps me
Mhm.
anyway.
Yeah. Yeah, I think, yeah, gratitude is a really powerful tool for when feeling like stressed or overwhelmed. I think, yeah, gratitude is a pretty amazing way to kind of come to the surface a bit.
Yeah, absolutely. And writing those things down helped me. And the other thing that
Mhm.
I do too, I think it drives my wife crazy, to be honest with you, but I try and express gratitude to her as often as I can. First of all, she deserves it, but it also keeps me grounded and makes me realize how important our our significant others are and our families are, and all of the things that they allow us to do together. So expressing gratitude specifically to the people who deserve it, I think, is important also.
That's really sweet. Yeah, I
Yeah.
like that.
Yeah, I think she's like, you can probably stop saying thank you for, laundry and food and other things like that. I'm like, but it's important, if I could have done the laundry today, I would have, but I just didn't happen. It didn't make
Yeah,
it didn't make the checklist. It didn't get a circle on the checklist. So it didn't
yeah.
happen.
And any last advice for me in terms of just like you start in the early phase of the career and kind of incorporating these things particularly kind of with respect to work and being an educator.
Yeah, I think intention is one of the things that's incredibly important. When we talk about the key components of mindfulness, it's intention, presence, and being non-judgmental. And the presence and non-judgmental are kind of things we work on our own that kind of happen. But where we can really sit and invest time is in intention. Who do we want to be and how do we want to get there? And there's lots of ways to do this. I kind of coach people and I work with junior surgeons all of the times, and we run through a bunch of exercises, writing down and going over your values, reflecting on who your heroes are, thinking about the ways you want to be remembered potentially in your institution or in your field or whatever context you want to put that in. But I think it ultimately comes down to what fulfills you. That's the big question. That's the really hard one. What is fulfilling? Because it doesn't matter if you make $10 or $1 million. If you work long hours or short hours, if you're fulfilled at the end of the day, you will be happy and productive and enjoy whatever comes your way. And so that's the big question that's worth spending time on. And when we think about the tasks, and especially when you're junior faculty, you're going to get asked to do a lot of things. And it's okay to say yes. And you should say yes to a lot of things, particularly when we're first starting out. But as your time fills up and you can and should be a little bit more selective with your time, you should be saying yes to things that fulfill you or move you in the direction of fulfillment. And if it's not contributing to that sense of fulfillment for you, it'll contribute to somebody else's sense of fulfillment. So it's okay to say no and make a suggestion. You know what? Sorry, that doesn't make a lot of sense for me, but it may make sense for so and so. And I think people are a lot more tolerant of no than we think they are. And
Mm.
especially when we qualify it and say, this is what I'm thinking. I'm not just not being a jerk. I'm saying no because I'm trying to do X, Y, and Z. And what you're proposing is valuable, but not as valuable as those things are to me. And I think that's the biggest piece of advice I give to kind of junior faculty and young people trying to figure out who the hell they're going to be. And I wish I spent more time. I would have been a lot more efficient, I think, if I spent a little more time with direction and who I wanted to be, and recognize too. And I'll tell you this now, being 11 years into kind of my formal practice, is things change and evolve.
Yeah.
Never would have predicted that I'd be sitting here doing this 10 years ago, and who knows where it'll be 10 years from now. So, go with it. And because of that, because it's going to evolve, you've got to revisit those thoughts and that sense of fulfillment and values and heroes and all of those other things. Probably everybody's a little different, but probably a 6 to 12 month cadence is the right way to kind of formally think about these things.
Thank you.
Yeah. Sorry, a little long winded there,
No,
Betsy,
it's,
but
I appreciate it. That's good. Thank you.
yeah. And then the last thing before we wrap up, we've been talking this season on Operate with Zen. We've been talking about vulnerability, and vulnerability is a challenge for surgeons. It's hard to express vulnerability, especially when you're supposed to portray a strict sense of kind of confidence and sometimes infallibility, but we all know that's not the truth. So just wanted to get your thoughts on vulnerability as a trainee, as a surgeon, as a young surgeon who's kind of, building their career. How do you think about vulnerability, and how does that play into who you are?
Yeah. Yeah. Vulnerability. I think it's both like it's so challenging. I mean, nobody really wants to kind of have themselves exposed or expose themselves as maybe not being um I feel like I think about it in surgery as being like as good at something or as we want to be or feel like we should be at a certain point. Um, it's really hard to do, but I feel like in some sort of key times when I've when I've been vulnerable, and I kind of think more relatively recently, but just earlier when I was after I moved here and I have my own little half day of clinic here, and it was just harder to do than I had really anticipated, and I thought it was going to just start off going great, but it was just kind of clunky and for me, and incorporating and just like different ultrasound machine for prostate biopsies, and it was just not super smooth at first, and I did not like that. I don't just want things to kind of be going great all the time, and but once I just it comes to a certain, I feel like it kind of came to a certain point where like I need to just be vulnerable, if you will, um and reach out to some of the faculty and kind of like figure out how a couple of the things on like the ultrasound machine worked, and kind of just some of the relationships with the clinic staff, just working through some of the just kind of clinic flow things that we had been dealing with. And then once I feel like I just kind of sought help or put myself out there, it was almost like instantly everything was better. And I think so. I think with vulnerability, it when I've had it, I feel like when I've had some notable moments in my life, it just starts inside of me. There's a little thing where it starts to really tell me I need to just do it, and it's hard to do because we don't like to put ourselves out there like that. But once you do, I think it's a really really amazing way to actually move forward and grow and learn, and just if I could say one other thing I think about vulnerability is I think it's a way that makes us feel more connected versus as just different people with very different identities, and I'm the surgeon, blah blah blah, but we're all really quite connected. And I think showing this being vulnerable is a way that really helps people feel more connected.
Yeah, absolutely. I think those are great insights, and it's challenging to express that sometimes, just to get over that hump. Some of the ways I've done it recently, I own mistakes very publicly, especially now in a position of leadership. So for instance, this was something really simple. We had, somebody was scheduled for a uronav biopsy, which is a fusion biopsy for the non-urologists in the audience, where you take an MRI and it gets fused real time to an ultrasound machine in clinic. And even though the patient's MRI was done in the Penn system, it was done at a different hospital, and it wasn't registered, wasn't kind of appropriately registered for the ultrasound, and the patient's procedure had to be canceled. And it was totally our fault because we didn't know that if it was done in system, that it had to be registered and blah, blah, blah. It was a totally different order. So just simple things like that. sent an email to the faculty, say, hey, we made this mistake. These are the things you need to do if you encounter this situation. Try not to make this mistake again because we're pretty embarrassed about it. And just simple things like that, show that it's okay. Your leaders are going to make mistakes too. They're actually going to make a lot of mistakes. And that means they're there to support you if you make a mistake. So open up about those things as well. And I think the other really tangible way to do this, and I got a lot of this from coaching actually, is ask somebody what's going on in their life or how their day's going, and then just sit there and listen. Don't tell them about your day. Don't offer advice. Just let them talk. And they'll express some vulnerability. It will happen. Guaranteed it will happen. And then that's your cue to be vulnerable with them. And then all of a sudden, you've just built a relationship. And that's how these things happen. So you can't force it. And sometimes you may have to be quiet with them for an extended period of time or multiple questions, but it will happen if you give people space and genuinely just sit there with them and listen.
Yeah, absolutely. Yeah, I think I don't have anything new to say, but I agree.
Well, good. Well, Betsy, it's been an awesome time talking with you. I'm just going to sum up some of the amazing things you said and the amazing things we talked about. We started on transcendental meditation. We talked about the basics of that and how it really, the premise is by relieving thoughts, we can relieve stress. And we talked about yoga and running and how these are all basically different forms and different action levels of meditation and being mindful and being in the moment. We talked about how to prepare for surgery, scrubbing our hands and thinking about cases and trying to lower the anxiety levels around the incredibly anxiety-provoking tasks we're about to do. And we talked about vulnerability and connecting with people. It was a wonderful hour. I can't thank you enough for spending time with me. And I know people are going to benefit from this conversation.
Phil, thank you so much. It's really my honor to be on your show and to talk to you. I'm a big fan, and this has been a really great conversation. And truthfully, I'm glad that I'm going to get to replay some of the pearls that you shared in the future. But yeah, it's really special that you have this to share with our community. And thank you so much for inviting me.
Thanks, Betsy. I look forward to our next yoga class.
Yeah, for sure.
All right. Have a wonderful day.
Okay, you too. Bye, Phil.